marijuana, which is currently classified as a Schedule 1 substance, should now be reclassified to a Schedule 3 substance. So, what is your understanding of Schedule 1, 2, 3?
Schedule 1 drugs are things like heroin, things that are criminal, have a high criminal potential and high negative impact on society. Schedule 3 medications that are controlled, medications that do have a potential for causing problems, but they also have a lot of health benefits. So in that sense, moving marijuana from Schedule 1 to 3 needs to be studied. We really need to look at the impact. I'm not saying we should not do it. I'm just saying we should look at states like Colorado that's legalized marijuana, see what are the impact of legalizing marijuana, what are the benefits of it, and have an open discussion before we jump from 1 to 3.
Right.
I think that we should even, for physicians and patients, let's really talk about these schedules. So when you're a doctor, you get a DEA license, so the DEA Drug Enforcement Agency license. And I remember when I was a resident, you want to say you can prescribe all levels, Schedule 1, 2, and 3. So again, 1 is we would never prescribe anybody here. I can't imagine doing that. Then Schedule 2, most of us as surgeons do prescribe Schedule 2 medication. These are your Percocets, your oxycodones, that is part of the Percocet, but your hydrocodones. These are your very strong medications. Then
narcotics.
Your narcotics. Then your Schedule 3 are there's not as strong Tylenol with codeine, and patients know these are not as big. I think your ketamine, your weight loss medicines like Adipex, those are in that Schedule 3 Ritalin. So they're trying to bring marijuana to that level, a level of Tylenol with 3, Adipex, Valium, Xanax, things that, so do we want it to be in that category? And as a physician, the effects of it, is it kind of like a Xanax? Is it kind of like a T3? Is it in that area that you would, if you had to prescribe it to somebody, that you would feel that same level of responsibility or impairment that you would give somebody that medicine?
I'm not a specialist, but I think part of the classification is also the risk of abuse, substance abuse.
Right. So
I don't think marijuana compares to some of the substances that we mentioned. And not only that, I know you brought up alcohol, but we can't really compare it to alcohol because alcohol isn't monitored like this.
It's not.
And that's
my
very
point,
interesting.
Though. Yeah, that's my point.
Because
it just makes
alcohol, if you look at the cost, just dealing with the cost, like cirrhosis, dependence,
pancreatitis,
fatal accidents, that's billions of dollars.
Right.
So imagine if we just regulated alcohol, if alcohol was a schedule, it would change people would lose jobs.
It's big business, so they ain't gonna touch it. But what I'll say to your point is, yes, a Class 1 drug, it's a substance, or a Class 1 substance. It's not like therapeutic.
Right.
It has, as a matter of fact, it's deemed to not have any therapeutic effects. Right. Has a high rate of addiction, and it can be harmful. Right. Yep. You take heroin, you can overdose like that. Right.
Right.
Ecstasy, you can overdose. Okay. And then there's Class 2 drugs.
Where is fentanyl in this?
Fentanyl's Class 2.
Yeah.
It's still Class 2.
Right. So the reason why the Department of Human Health Services are recommending that it be reclassed to a Schedule 3 is the following. It simply just doesn't meet a criteria, right? So to your point, marijuana has been shown to have some therapeutic effect, right? Again, we've had medications like Sativex that are used for patients, who are undergoing chemotherapy to help stimulate their appetite. Also, over the last 4 years, if you're in the state of Georgia, here it's not legal, but you could go into a smoke shop and buy Delta 9, which is damn near the same thing from what I understand.
I don't know.
So, but they have a lot of we have a lot of information now based on Delta 9 THC, which is that's the psychoactive portion in cannabis. And what they find is that it isn't addictive like that. That if you stop it Withdrawal symptoms will last about 2 weeks. They'll peak at 2 weeks. They're not terrible. You may get like a headache, a little irritability, but then you're off of it. It's not like alcohol withdrawal where you could go into like DT, right, where you have these tremors and get real sick and can die. Heroin, you have to put them on methadone to wean them off. So this is not that, and it's for these reasons that it's been proven, it's been used for therapeutic purposes. It doesn't have a high addictive property compared to the other Schedule 1 or Schedule 2 drugs. And lastly, it's just not dangerous. I mean, we talked about alcohol. If a kid drinks like a fifth, right? They're going to get sick, real sick, could potentially die. We've had cases where kids have ingested like whole edible bars when you should only be eating like a fraction of it.
Right.
They get sleepy. They may feel dehydrated, but overall they're fine. Like, I mean, I had a friend, he had a kid that accidentally ingested it.
Right.
Was sleepy, but then next day was fine.
Yeah, Mark, I agree with you on the fact that it's definitely not as dangerous as a Schedule 1, but is it as safe as a Schedule 3? There are cases, reports of users developing, psychiatric conditions like, depression and schizophrenia type symptoms as a result of it. I just think maybe Schedule 2, but Schedule 3 is, to me, it sounds like a lot.
There we go.
Perfect.
All right.